Okay. Hi, everybody. I'm Wallye Holloway with Black Health Now. Welcome to Black Health Now. I'm thrilled. This is an event that we're doing in partnership with the American Diabetes Association and also Omnicom Health Group. So I'm thrilled to have our guest today, Tracey Brown. She is the CEO of the American Diabetes Association. This is actually American Diabetes Month, but I want to introduce her before we dive into this important conversation. So Tracey is the Chief Executive Officer of the American Diabetes Association, the nation's largest voluntary health organization and a global authority on diabetes. Tracey herself has been thriving while living with type 2 diabetes for over 15 years. She's the first CEO in the organization's 80-year history that's living with type 2 diabetes and is committed to stopping the epidemic that is diabetes. She brings more than 25 years of experience in driving global business growth, leveraging data to connect consumers with brands, and creating omni-channel experiences to escalate customer loyalty. Tracey joined the ADA in June 2018 after her tenure as Senior Vice President of Operations and Chief Experience Officer at Sam's Club, a division of Walmart, where she was responsible for creating meaningful member experiences, directing member strategy, marketing and branding, go-to-market execution, data and analytics, and membership operations. She earned her Master's of Business Administration degree from Columbia Business School in New York and a Bachelor of Chemical Engineering from the University of Delaware. Tracey has always been passionate about the ADA's mission and served as a member of the ADA National Board, in addition to volunteering and fundraising for the ADA in her local community. She and her family reside in the Washington, D.C. metropolitan area. So Tracey, again, welcome. We're thrilled to have you. Thank you so much for joining us.
Wallye, I'm so excited to be here, and boy, that was a mouthful. I thought you got the short intro, but very excited to be participating here on Black Health Now. And as you said, it is Diabetes Awareness Month, so I want to throw out there right now that I hope everyone who is tuning in knows their numbers, both their A1C numbers and their blood glucose numbers. So I just throw that out there right from the start.
Well, that's important and not surprising, obviously, because you run that organization. So it is important. Thank you for that. So I'm going to dive in because there's a lot to talk about as it relates to diabetes, because it's important. There's so many people in this country who have diabetes, and it's a challenge sometimes day to day to manage. There's lots of treatments out there, but it's an important part of what we need to focus on, and certainly your mission. So as you think about the organization that you lead in diabetes and the positive impact and change that your group can bring about, what specifically are your areas of focus?
So, Wallye, let me just start by saying, if you think about trying to improve the health and well-being of Americans, even today, you can't start thinking about that without having a conversation regarding diabetes, because diabetes is so pervasive, with 1 out of 2 people in this country either living with pre-diabetes or diabetes. That means everyone knows someone. I'm sure everyone who is tuning in right now knows someone, if not themselves, that is affected by diabetes. The second thing is, you can't have a conversation in this country around improving the health and well-being of Americans without actually talking about the health inequities that have plagued this organization for some time. And so when you think about our mission, and diabetes being one of the most prevalent chronic diseases, you start to think about the statistics, Wallye. Every 2 minutes, somebody is dying from diabetes and its complications. Every 2 minutes, somebody's having some kind of heart-related disease due to diabetes complications. Every 4 minutes, someone is losing a limb, losing some part of their body due to diabetes and its complications. And then every 10 minutes, somebody's having kidney failure from diabetes and its complications. And I don't think that people really quite understand the magnitude of diabetes and its impact on this country. And so when you think about the mission of our organization, what we're trying to do, first and foremost, we are never going to stop fighting to find a cure, right? I would like nothing more than not to even have the American Diabetes Association anymore because we found a cure. But while we are fighting to find a cure, what we're going to do is help people living with diabetes live their best life right now, today, while we continue to fight for that cure and drive awareness and understanding about this disease. The more that we can get people aware and knowing, the more you can actually get people doing one of two things: not moving from pre-diabetes to diabetes, and if you actually have diabetes, thriving while you're living with this disease.
So as you think about kind of like, to your point, awareness is really key. Like, where's the knowledge gap mostly? Is it, do you think around the complications, or is it the magnitude of the people who actually live with diabetes every single day and have to manage it?
I think, you know, the data tells the story. You know, there are 84 million people alone walking around with pre-diabetes, Wallye, and 90% of those people don't even know it.
Yeah.
So the part of the issue with diabetes is that they call diabetes the silent killer. And why is that? Is because you can go a very long time without actually knowing you have diabetes because you kind of feel okay until you hit the complication, which usually causes you to go to the doctor or, God forbid, even the hospital. And so because diabetes is about your blood and your blood glucose, people will go years without actually even knowing that they've had diabetes. And I think that's part of the problem, Wallye. So you've got just the sheer, people have no idea that they're even walking around, which is why you have to like do testing. And oh, by the way, when you go to the doctor's office, it should be like, you know, when you go to the doctor's office, they have you step on the scale, they take your blood pressure, they should be taking your blood glucose and A1C as well. It's not a standardized thing. And then the last thing that I will say is diabetes is still one of those chronic diseases that have a lot of stigma associated with it, particularly people living with type 2. So type 1 diabetes is an autoimmune disease.
Right.
Type 2 diabetes is not. And oftentimes people believe that if you have type 2 diabetes, somehow or another, you caused it yourself because of how you're living in your lifestyle. So I've been living with type 2 diabetes for 17 years. I go all around the country talking about diabetes as my personal form of trying to drive awareness. And 9 times out of 10, after a presentation, someone will come up to me and say, "You don't look like you have diabetes." Well, what does that mean? What is the look of diabetes? And because of the stigma, oftentimes people who have diabetes don't actually talk about it. That's part of the issue.
That's a big deal. I mean, stigma, you know, we've talked on Black Health Now about stigma associated with a lot of conditions. And, you know, to hear you say that even today with diabetes, with, you know, the level of awareness that there is, 84 million people you talk about, and still there's stigma associated with it, that's something definitely we have to overcome. But I want to go back to your other point around, like, people don't know it. So, you know, one of the things that comes to mind for me then is knowing your numbers, which is how you started this, right? Like, really proactively making sure that people can lean in on it when they're interacting with their physicians to say, what are my numbers? So that, to your earlier point, we can at least, you know, identify it earlier. So, but, you know, it's not just, to your point, it's not about, you know, genetics, it's, you know, there's stigma, but, you know, when we get to the root of the issue, and I want to go to your Health Equity Now initiative that the American Diabetes Association has, you know, there's a lot of conversation right now in the medical community around, and the advocacy community around equity as it relates to health. And I just wanted to wanted to hear a little bit more about that initiative because it's important. And as it relates to diabetes, kind of what are you guys trying to accomplish there and how can we help?
Yeah, so boy, Wally, this health inequity has plagued this country for quite a while. And, you know, what this pandemic has done, this COVID-19 pandemic, is really started to shine some very bright lights on some very old problems. Diabetes was an epidemic before the pandemic, and we have been dealing with health inequity long before the pandemic and long before the social and racial unrest that erupted after the George Floyd murder and all of those things. But wealth is health in a sense, Wally, and when you actually start to look at the disproportionate number of people who are plagued with diabetes, one of the things that you look at is the inverse correlation of net income and diabetes. You start to look at the number of people who are disproportionately affected by diabetes are people of color. Mm-hmm. You start to look at the number of people who are living in this country that are living in poverty, 38 million or so. 76% or so of those people are people of color. So then you ask yourself, Wally, how could that be? Well, this is where you actually have to lean into systems, policy, legislation, laws, history, and you hear people talk about the social determinants of health and the social determinants of health driving this increase in diabetes. But let's just peel the onion back a little bit on that so that you can actually start to see these social determinants of health that everyone's talking about. You can trace those back to history. Let's start all the way back with, I mean, you could go back to the inequities 400 years and starting with slavery. I'm gonna bring it up forward. You know, slavery is in the 1600s, but let's bring it to the 1790s, right? That was when the first rules were established around granting citizenship in this country. This is a very early form of inequity because it excluded people of color. And if you don't have citizenship, you actually couldn't purchase land. Land was an early form of wealth. I'll take us down to, that was 1700s. Let's go to the 1900s. In 1933, there was a New Deal legislation around relief, recovery, and reform. That was $120 billion available in loans back at that time. 98% of the loans went to Caucasians, non-people of color. That's in the early 1900s. Let's keep on coming down. 1945 or so, the GI Bill. You talk about education and the fact that the returning soldiers had this opportunity to actually tap into, I don't know, it was like $95 to $100 billion for free education. Didn't apply to people of color. Let's keep taking it down. 1950s, 1960s, redlining. That's where that actually became a thing. Tied that to where people of color live. Again, another social determinant of health. And then let's bring it all the way back down to even the 2000s. You know, the Great Recession that happened in 2000, 2009. There was kind of a relief package, a stimulus package for that, about $840 billion. Didn't apply to people of color or the neighborhoods where people of color live. and I can just pull this string through the sweater all the way down to what we're experiencing today. So you see these laws and legislation and history and policy form the social determinants of health. The social determinants of health, there is a direct link and connection to inequities and to diabetes. So that was a long way for me to get to our Health Equity Now platform, which basically, when we started to see what was really happening as it relates to just COVID-19 in this pandemic. First, we saw the early data that told us that people living with diabetes were disproportionately dying from COVID-19 to the tune of about 40%. Then we had data that said people living with unmanaged diabetes were 6 times as likely to end in the hospital and 12 times as likely to die. Yeah. Then you started to see the data of even those people disproportionately affected and hospitalized and dying from diabetes were people of color. And that's where we said, look, there are 34 million people living with diabetes. We have got to figure out how to navigate this pandemic and come out of this thing better and serving the audience that we need to serve. And when you start to think about why people with diabetes and people of color are suffering and dying and disproportionately affected, it lines up with the inequities. So we developed this Bill of Rights and said, look, what are the basic health equity Bill of Rights that people should have, and especially people living with diabetes? And we came up with 10. And there are things, I'm not going to list all 10, but everyone has the right to access their prescription drugs and their insulin affordable. Everybody should have the right to healthy food. Everybody should have the right not to face stigma. Everybody should have the right to the latest medical advances. So we had 10 of these Bill of Rights that then lathered up to 5 pillars of our Health Equity Now platform. One is around cure and research and the lack of diversity that is happening in that space. Even when you think about the clinical trials, Wallye, that are happening right now, they lack the diversity of people of color. In fact, there was a recent study that said 90% of people who participate in clinical trials are not people of color. Our second pillar was cost. Everybody should have accessibility to the diabetes drugs, devices, supplies, and insurance that they need. The third is care. Everybody should have the opportunity to have access to quality care in their neighborhood. The fourth is cuisine and food. I cannot tell you how disheartening it is to understand the number of food deserts and food swamps that exist in this country, and the direct connect to diabetes is startling. Everybody should have the access to healthier foods. And when you look at lower income neighborhoods, what you see is the majority of them actually don't even have grocery stores. They have the convenience store, the bodega, the gas station, usually some fast food, and a liquor store. Yeah. That is not okay. And then the last is community. If you want to change behaviors, it first starts with trust. And you got to figure out how to enter communities and establish trust with the communities. And once you've established that trust, then you have to figure out how to emotionally connect, because people feel before they think. So those became our 5 pillars. And this has become our rallying call. Why, Wallye? Because good health and access to good health care is a human right. And that means that's all of our issue.
Yeah, I love the way you put that. I mean, it is a human right, right? Access to good health care and, treatment and outcomes, it's all related. And you talked about some of the issues that really perpetuate like the disconnect. You went back in history a moment ago and you talked about kind of where it all comes from. And then here we are today, right? It's 2020. And I know that, professionals like yourselves, medical researchers, they're talking about kind of it's a bellwether event a bit. COVID, and it's a bellwether call for people to notice and lean in a bit more on doing something that can help impact the statistics that you talked about. So, a lot of these things have to do with, structural barriers, for example. The medical community has a role to play. On Black Health Now, we've talked to physicians around this idea of health inequity, and medical schools are starting to lean on it. Physicians are becoming very vocal about it. So, as you think about your constituency and, people who are living with diabetes day in and day out, how can we help to overcome some of that, right? If, to your point, they have to find an Uber to go to a grocery store to get fresh fruits and vegetables, or, they have to advocate for themselves in many ways because the system isn't necessarily, readily doing that as much as we'd like how can, what can people who are living with diabetes do to help?
Yeah, so it is a multifaceted issue, and I say if it were easy to do, certainly we would have done it. I mean, we've been at this for 80 years, and other people have been at this for 80 years. It's a complicated issue that's going to require all of us. And I believe kind of there are a few swim lanes about how to think about it. As a person living with diabetes, there are some things that we can do to help manage what we can manage. And I try to help people understand we have more power than we think we do. So first and foremost, even if I think about the management of my own diabetes, Wallye, truth of the matter is I was diagnosed 17 years ago with gestational diabetes, or 80% of the women, the diabetes goes away. I was in that minority, 20%. I'm a type A person, hard charging, driving, research a lot, all these kinds of things. And the fact of the matter is, Wallye, I didn't take my diabetes diagnosis seriously for 5 years. So 5 years, myself, had elevated blood sugars running through my body for 5 years until my 5-year-old daughter at the time, we were getting dressed. She would see me take my insulin. She would see me prick my fingers every day. She's 5 years old. We're getting dressed, and she looks at me and says, "Mommy, are you going to die from diabetes?" That was the emotional connection and turning point for me. But even for me, it took 5 years. So we can't do that. And so this is why I say, one, being aware. Two, you have to understand from a nutrition standpoint, the food, even the food that you have, even if you're not living in a place that has a grocery store for you to get the fresh fruits and vegetables, there are ways for you to manage what you're eating. And so, there are multiple kind of nutrition therapies, from Mediterranean to paleo to low carb to so on and so forth. For me, I manage the carbohydrates that I put in my body. Why that? And this is why I try to let people know, wherever you live, whatever your circumstance is, you can understand the carbohydrates in your body. Diabetes is about your food turning into sugars to provide you energy. Insulin unlocks your cells so that the blood sugar, the glucose can get in your cells to provide energy. If you manage carbohydrates that you're eating, carbohydrates turn into sugar. So if you know nothing more except for, look, if I have diabetes, that means I have too much blood sugar. My blood sugars are too high, too much sugar in my blood. I'm just going to be conscious about the carbohydrates that I'm eating. If you do that, that is a positive step that will help you no matter what. 2, exercise. We know for type 2, people living with type 2, exercise helps manage your blood glucose level. So even if you cannot get to the gym every day, that's okay. Many of us are still homebound for COVID-19. Get outside and walk. Okay, maybe you don't want to walk. I have a 17-year-old daughter. She's really into TikTok. We go do a TikTok something every single day. That's exercise. So just get your body moving. But this exercise is a very important one. And then the last couple that I'll go through really quickly, sleep. Sleep affects your blood sugars more than people know. I used to pride myself on being a night owl. I don't need much sleep. Who needs sleep? It's overrated. All this other kind of crazy stuff. Until I started actually managing and looking, I wear a continuous glucose monitor to see the impact of a lack of sleep on my blood sugars. And I was like, oh my goodness. And then the last one that I'll throw out, Wallye, is stress management. Stress does a lot of things to a lot of people. One of the things is it elevates your blood sugars. So those things are well within the realm of any single person, Wallye, to manage. So that is one, as a consumer, as a person living with diabetes or not, manage those things. 2, demand that you know your numbers when you go to the doctors or the clinics. Or by the way, if you say, I don't even go to the doctors or the clinics, many pharmacies, Walmart, CVS, Walgreens, the like, they have these wellness fairs. Go to the wellness fair, you can get your A1Cs and blood glucose checked, usually for free. But you gotta just know. Okay, second thing, second swim lane. So there's the consumer, the second is healthcare professionals. Look, the healthcare professionals have a role in helping us, bend the curve of the diabetes epidemic, B, helping us dismantle some of these inequities. Unconscious bias is real, right? And so based on the history that I laid down earlier, as well as to what you were exposed to, your belief systems, your brain automatically goes into fast automatic brain, and that's where bias is actually introduced. So as people and as healthcare professionals, we talk about the fact that you have to introduce bias interrupters. So when you are, there's all kinds of data that tells you things such as people living with diabetes that are people of color are 2 times likely to have an amputation. Why is that? Is there some implied thing that people may believe that the best answer is to get rid of the limb? I will tell you, I use a CGM, a continuous glucose monitor. I encourage as many people as possible to get a CGM. I've had many people come back to me that happen to be people of color that said their healthcare professionals thought that A, they couldn't afford it, or B, too complex, but that's not your decision to make. So those are possibly unconscious biases that creep in. Mm-hmm. 2, as it relates to things like clinical trials, we've got to get to a trusted place, because there's all kinds of history around why people of color don't participate in clinical trials anymore. Tuskegee, there's a whole rationale. So if we want to actually change that, we actually have to start establishing trust. And so, do you have investigators that look like the very audience that you're trying to recruit and serve? The same with doctors. You talked about this earlier. Medical institutions. Do we have doctors that look like the people that we're serving? Like all of these things. So there is a role there. And then the third role, so there's the consumer, there's the healthcare professional, and then there's this third role, which is there's an entire ecosystem that includes prescription drug manufacturers, retailers, government officials at the federal and state and local level. I mean, I could go on and on. Everybody in this ecosystem has a role to play if we want to take down the inequities, which we have sounded around the 10 Bill of Rights, but everybody in this ecosystem has a role to play if we want to A, find a cure, and B, get rid of a lot of these barriers that are stopping people from being able to live their best life right now. And a lot of that has to do with access to either quality things or affordable things that the ecosystem has a lever that they can pull.
Yeah, there's a lot to unpack there because you obviously you covered off on the key issues that are important for the communities and like you said, the ecosystem to be aware of. But I just want to double click on the clinical trials for a moment. And because this is something that we've talked about before on Black Health Now, it's something that I've talked about in my professional life with others is, this concept that it's a little bit of a cycle, and you said it, right? There's reasons throughout history as to why there are issues sometimes with people of color joining clinical trials. It's been well documented. I think a lot of the people who are watching are well aware of that. But then there's the other side, which is the perception that people of color won't join clinical trials, and that's not the case. I mean, to your point, partnering with them, understanding, making sure that, they're being approached in a way that makes them feel like the professionals understand their journey and, making sure that they're really explaining the benefit. And in many cases, what happens is people do want to participate in clinical trials. So I just wanted to pause on that for a minute and see if there's anything else you wanted to add, because I do think there's a huge opportunity. And, there have been some researchers who have leaned in on this issue, gone to the communities and the experts and said, help us here. How do we do this? And their trial enrollments with people of color went from like 3% to 18%. So, it's possible, it's important. I completely agree with you. And I think there's a lot more work to be done there for sure.
It's possible.
And then,
oh, sorry. Yeah.
No, go ahead. Finish your thought.
I was just going to say it's possible, and it's important and critical. Look, to have successful drug therapies and solutions and cures, like you can't get there unless you're actually testing said drug or trial with the audience that is living with said disease or sickness. And I do think it's a myth, it's a misnomer that African Americans will not participate. But you do have to break down these and dismantle these barriers. And the first barrier is people assuming that they don't want to participate. Barrier two is what I talked about earlier, like there has to be trust there. Barrier three is there's a real cultural trend right now around distributed trust, which says, I will trust my family, my friend, my neighbor, my colleague before I will trust the establishment. Okay, if that's a real cultural trend, then how do you get information about trials to the people, the tribe that people do trust? So you got that going. Then there's another real cultural trend happening called, frictionless life, frictionless behavior. People want things to be easier. So if you're going to go into a community and try and recruit for a clinical trial, you also have to put your head on around what are the points of friction that are in the way that make this not easy to participate in a clinical trial. So you got to make it simple, frictionless, and it needs to be in snackable bites. People don't have time, Wallye, anymore. And so you've got to design the recruitment, the engagement, the report out in ways that align with a lot of these cultural trends. But first and foremost, if you don't have trust, you're not going to get there.
Completely agree. Trust is really key with communities of color, especially with the Black American community for sure. So you talked about this concept of kind of stress management as being kind of one of the keys that people can do, and getting enough sleep and making sure that they're kind of caring for themselves as a way to help to better manage their diabetes. You know, so one of the concepts that's being talked a lot about in the research community is this concept of weathering. It's being talked a lot in the vein of like maternal and infant mortality in the Black American space. But it's really interesting. Weathering is also something that, again, as it relates to Black Americans, that comes from the things you talked about earlier, right? Kind of the legacy and the history of racism and, you know, subpar health and health priority for this community. And I think it shows up in conditions like diabetes and other conditions that are so prevalent within the Black American community and communities of color. But I don't think that often we recognize the impact that that can have on our ability to manage or even prevent some of these chronic conditions like diabetes. And I think there's an opportunity for even more awareness. And secondly, related to that point, if you're not aware of some of the root causes, also this idea that I think there's a low awareness around some of the conditions and some of the exacerbations around diabetes that can happen. You talked about amputations and things. Why is that? Because I think people often think that it's under control. There are medications to treat it. It's not that big a deal. As long as you take them, you're okay. And sometimes people aren't taking into consideration the other things associated with self-care that are so important.
Yeah, I mean, I couldn't agree more with all that you just said. I think we need to talk about these things more, first and foremost. And even on the amputations, I talked to a lot of people, and before COVID, traveled a lot. And funnily enough, people almost resign themselves to well, I'm going to get diabetes. Like, my mom had it, my dad had it, my grandma had it, my blah, blah, blah. Like, so there's already kind of this implied assumption that, oh, well, I'm going to get it. And then there's a further implied assumption that losing your limbs is kind of what happens. Like, that's not, like, what has happened in the world or in communities where that is accepted? So it's just not okay and under any circumstance. And I think part of this is not only the awareness. I mean, knowledge is power, but not accepting the plight of what may have happened, whether that is in your family or your community or your whatever. Like, not okay.
Hopefully, though, through greater awareness, the work that the ADA is doing, that people will start to recognize that it's something that does have to be taken seriously, and that, no, you're not destined to have all of these complications happen. So as you think, I mean, the ADA has done so much work, and there's so much advocacy and education around the efforts to really help people understand better, what more can and should be done. And I love the kind of tenets that you outlined earlier, which are what are the keys and components of kind of better care as it relates to diabetes. What's your biggest hope for kind of where you guys go next? I know you said earlier that, you'd love to not exist anymore because there's a cure. I think that we would all hope for that. But, as you think about your mission and certainly the initiative around health equity and creating awareness for better care for patients and people living, not just patients, but people living with diabetes, what's your greatest hope?
Yeah, I mean, truthfully, well, if I take it at the macro level, the numbers in terms of people living with diabetes are growing. They're not getting better. And that is actually not okay. Right? Like, the hope is with all that we are doing, that we start to see impact in terms of less people living with diabetes, or you're right, and less people dying and suffering from these complications. That's at the macro level. And I think, we as an organization are attacking how you do that in a few ways. One is the science and the medicine, right? We've got to continue to lean in to the science and the medicine, the research around both cure and what is required to help people thrive if you're living with diabetes. The second is advocacy, and leaning into advocacy in a bigger way. We call it big A advocacy, because we have to start to dismantle the policies, the laws, the legislation, and influence those things. And we were successful in influencing a lot of this, even for COVID-19, with people living with diabetes, in terms of being able to use your CGM in the hospitals, which what wasn't approved. Being able, when everybody went to telehealth and telemedicine, being able to still get your insulins refilled, your CGM prescriptions refilled without the in-person visit. So the big A advocacy piece of this has to continue. And then this community piece of getting in community and driving awareness around diabetes and the power that you actually have. But the last one that I'm going to double click into is nutrition. Wallye, when you look at the, US dietary guidelines, those guidelines, when you read them, were developed for people who are healthy Americans. 60% of Americans are living with a chronic disease. Those dietary guidelines are the very guidelines that are used in programs for like SNAP. They're used in schools. They're used in hospitals. They're used in prisons. So like these guidelines need to be modified for people living with diabetes or other chronic conditions. 60% of Americans are not well. They have a chronic condition. So the nutrition would be the other place you're going to see us continue to lean in.
Yeah, nutrition is a big one, not just for people living with diabetes, but for, to your point, for lots of people. It's just very different today than it was 30 years ago or 10 years ago or 40 years ago, even in terms of the foods that we're consuming that often lead to the conditions that we're talking about here today. So, a lot of, going back to the conversation we had earlier around, there's a lot of gaps to be filled, right? And a lot of, in the ecosystem, there's a lot still to be done. So the medical community, the, patients themselves and people living with diabetes, who are the best partners to help kind of impact change in the short and the long term?
Yeah, I get that question a lot, and I say everybody has a role. I mean, people are like, what do you mean everybody? But everybody does have a role, Wallye, because again, 50% of Americans are affected by this chronic disease, and everybody knows someone. So we have been talking about the creation of what we call the fourth network. What is the fourth network? We believe that the fourth network is necessary in order to manage diabetes or any other chronic disease. If you think about the existing healthcare networks that exist today, one network is hospitals. Another network is doctor's offices. A third network is urgent care centers. But each of those networks, Wallye, are created to handle acute problems. You have a heart attack, get to the hospital. You break your arm, go to your doctor's office. You got a call, go to the urgent care center. What they're not set up for is to help people who are living with chronic diseases and long term. Even if I think about diabetes, way back in the way back, early the 1900s when, diabetes was a thing, you didn't live long. This was before we had insulin. And so if you were diagnosed with diabetes, you were most definitely going to die and not live a long life. Thanks to science and medicine, people can thrive for a long time with diabetes and many of the other chronic conditions, right? Cancer, there's therapies now. So our networks are not designed for that. So there's this notion of creating this fourth network that we are calling kind of community-driven health. And why that? So we started by looking at all the cultural trends that are happening in the country and the world as it relates to health, healthcare, and community. And when you start to take all of the cultural trend data using machine learning and AI, there are about 25 elements of culture that actually pop out of that overlap of health, healthcare, and community. And there are some real cultural trends that have influenced our thinking around, if you want to manage diabetes and other chronic diseases, what are the elements of this new network need to be prevalent? And I talked about one of those 25 elements of culture being distributed trust. There's another element of culture called quantified self, right? More and more people wanting to know what's actually happening with their body. And with things like Fitbits, cell phones, Apple Watches, and the like, people do have more data about what is happening. I talked about this notion of frictionless and seamless snackable experiences. There is another cultural trend that talks about designing towards the average is not okay anymore, right? And so when you look at all these cultural trends, you start to say, okay, first and foremost, you've got to go to communities and start to build this fourth network in communities. You've got to have a voluntary health organization like ourselves that understand the disease states and the specifics. We bring science, medicine, content, data. Partnered with the voluntary health organization, you have to have the public. So partnering with the state and local, partnering with the community centers, partnering with the churches, partnering with the places that already have trust built in them, as opposed to you coming in as the ADA or, XYZ manufacturer trying to build trust. You go where the trust is already built. The third element of this is you've got to have the private sector, the rest of the ecosystem. For instance, retailers. So I'll just leverage Walmart because I know Walmart well based on my past, but there is a Walmart within a 10-mile radius of 90% of America.
I saw that stat before. It's amazing.
That is a place where you could actually start to partner and actually deliver the right kind of healthcare, food, and everything else. So having a private partner, another one that I'll use, I told you I use a CGM. You could also partner privately with a CGM manufacturer, any other technology. But you have us, public, private, and then the last piece is you need a data and technology platform to fuel all of what is happening so you can actually start to measure real outcomes in community longitudinally. So those are the components that we have been talking about in terms of creating a fourth network. And that's what you see us doing right now, Wallye. We talk about the fact that you get 1 point for doing, 1 point for saying, 9 points for doing. Let's stop talking about we need more data and Actually, we need more solutions. So we're leaning into creating these fourth network solutions in community as a way to once and for all start to take down diabetes. And it requires this kind of collaboration. No one entity can do it alone, We've got to figure out how to bring our collective strengths to attack this problem.
That's fantastic. That's really fantastic to hear of all the work that you're doing in that space, because it is needed. I want to get to a couple of questions because we had some come in. So one is, if a person has been diagnosed with pre-diabetes routinely, is diabetes inevitable, or can anything be done to turn that around?
So the turnaround for pre-diabetes is doing the things that I talked about earlier, which are really manage what you are putting in your body. So your nutrition, and people with pre-diabetes really have the real opportunity to not trip over into diabetes. You have some levers. Pull the nutrition lever. If you're not exercising, start exercising. If you are exercising, maybe change up your exercising. Sleep, sleep, sleep. If you're not, and I told you I was a night owl. I haven't gotten to 8 hours of sleep, but I will tell you, I moved from 2 to 3 to 6. And when I did that, my blood sugars actually stay in alignment. So if you're not getting a lot of sleep, change up your sleep patterns. And then this last one, which is more real than ever, is how are you managing stress? So Wallye, I used to say, I'm not stressed. Like, what? I'm good. Like, I know how to, but the fact of the matter is, if you don't even recognize when you're stressed, that's step one. And if you're not doing anything, especially in this COVID time right now, when I call people and I say, hey, how are you doing? They say, great. I know you're not great. There's no way you can be great. Like, the whole world has turned over. Try a few things. Even if you think you don't feel stressed, I had to try a few things. Someone was like, yoga. Yoga works for many. And if you haven't tried yoga, try it. It didn't really work for me. I couldn't, whatever. Yoga didn't work for me, but I went on to some other things. I tried breathing. There's just some simple things that you could do with your breathing. I've tried the sound, right? Ocean, or the sound bowls, those kinds of things. Being present and figuring out how to be present. There's a lot of, just search it. There's a lot of methodologies around that. And then the third, nature. So out of all of those things, here are the two that work for me. And how do I know that it works for me is because I do wear a CGM and I'm able to track the nature. Actually, being out in nature has a calming effect, not only on me, but it actually, when I'm a little calmer, my blood sugars go down. And the other thing that has worked really, really well for me is this notion of trying to be present and taking moments in my day to actually do that. So the stress thing, like, it's easy to do. You don't have to have a lot of equipment, Those are the things, if you're living with pre-diabetes, put those things in your arsenal and you will see an impact on your blood sugars.
That's great. That's really helpful to know. One more question. How can we help the cause as a collection of individuals who care about this topic passionately?
So I'll say a couple of things. Each of us has the ability to use our voice. So advocacy is one area that I have everybody. And so there's lots of ways that you can be an advocate. You could just be an advocate by talking about diabetes. Because I told you, everybody knows somebody. You can just start the conversation. 2, we do have ADA advocates. So you could register to become an advocate. And what does that actually mean? We reach out to and leverage our advocates both at the state and local level. We do as an organization a lot of town halls. with congressmen and women and policymakers, where we want people in those districts to show up on behalf of people living with diabetes. And we do that at the federal level. Our advocates actually help us when we are writing letters to lawmakers to drive change. They're helping us with the letters. So there's a lot of grassroots activities as well that you can do. So that's the advocacy lane, because I think any and everybody can use their voice. The second thing that I will say is, if you know someone, and I know everybody knows someone who's living with diabetes, be a support for them. I mean, this again, before COVID-19, living with diabetes or any chronic disease isn't easy. And everybody needs some support. And so I would say those that you know and are in your tribe, be there for them. And then the third that I would say is, you know, we do a lot of events. And, you know, before COVID, they were physical events, but now we're doing a lot of virtual events, whether it's runs or walks or galas. And that is a way for us to drive awareness and drive fundraising. So that would be the third area that I say. There is usually some local activity from American Diabetes Association happening in your community. You can get involved that way for sure. But we need help, Wallye. Let me double click into that. We need help with 122 million Americans being affected by diabetes or pre-diabetes. We need more people to drive awareness. We need to be able to continue to drive fundraising so we can deliver more programs in community, so we can deliver more research to actually help fight for a cure. So all help welcome all the time.
All right, and I think your points were important. So advocate, support, and then participate in the events and the activities that can lead to fundraising for the American Diabetes Association. You're doing some amazing work, so thank you so much. This has been a great conversation with Tracey Brown, the CEO of the American Diabetes Association. Any parting words? We're right up on time, but I really appreciate the opportunity to share all the work that you're doing with the folks who are watching this Black Health Now event that is done in partnership with OHG.
So first of all, I just want to say thank you for having us, Wallye, and this conversation and the platform. That's, you know, means a ton, because this is driving awareness. Secondly, I'm going to close the way I started. If you don't know what your blood glucose is or what your A1C is, I'm going to encourage you to go get that done. I'm just going to showcase mine. If y'all can see that, I'm at an 80, which is the blood glucose level of someone who isn't living with diabetes. Go get tested if you do not know your numbers. And then the last thing that I will say is, please, everyone, just be well, and stay safe.
All right. Thank you so much. Words of wisdom. Thank you, Tracey. And thank you, everyone, for participating.
Thank you, Wallye.